Men's health issues. Men's health issues have recently started to grab the spotlight. In general, the health of men is poorer than that of women, mortality rates are higher, and men use health services less often than women, even when reproductive services are taken into account. The health risks that men face can be prevented or treated successfully if diagnosed early. Gender is one of the most important sociocultural factors that impact health. Thus, there is a need for culturally competent medical care and prevention services that are specifically tailored to men. Gender, income, and health disparities. In 2017, the life expectancy of men was 76.1 years, about 5 years shorter than women. Shorter life expectancy may be due to hormonal differences, physiology, lifestyle, and health practices. Men have higher death rates than women for each of the 10 leading causes of disease. Men also smoke and drink alcohol more than men, and these may also contribute. Compared to women, they are also 1.5 times more likely to die from accidental deaths or unintentional injuries, 2.5 times more likely to die in motor vehicle accidents, the leading cause of accidental death, 5 times more likely to die by drowning, 4 times more likely to die from a firearm-related injury, and 4 times more likely to be victims of homicides. And they're also 4 times more likely to commit suicide. Rates of suicide are on average 4 times higher for men than women. For most age groups, suicide rates have remained unchanged since 1946, but for men 15 to 24, the rate has increased about 250%. Suicide rates for men 75 years and older are more than 9 times higher than women. We can see by this suicide rate by age for males and females how much more prevalent suicide is for men than for women. African American men are twice as likely to die prematurely from cardiovascular disease than white men. They also have the highest rate of prostate cancer in the US. African American men are 7 times more likely than white men to be victims of homicide. And homicide is the #1 killer of African American men 15 to 24 years of age. Men living in poverty are less likely to have a regular source of health care than higher income men. And 4 in 10 men living in poverty have not seen a physician in the past year. African American men and Latino men are less likely to be insured than white men. And more than 3/4 of white men have employer-sponsored health coverage compared to 2/3 of African American men and half of Hispanic men. Health-seeking behavior. The social construction of masculinity acts as an important influence in health and illness, and one that may both prescribe and limit men's lives. Dominant masculine cultures and values may negatively affect patterns of illness and men's experiences and behavior. Stoicism and suppression of emotion, for example, are values often associated with the socialization of men. Adherence to patriarchal masculine characteristics such as superiority, independence, self-reliance, and dominance may also act as a barrier to men appropriately accessing and using health services. Men are less likely than women to know general health information, take less responsibility for their health, and have regular checkups. Men will go to the doctor only in extreme circumstances. Men are less likely than women to know general health information, take less responsibility for their health, and have regular checkups. Many will go to the doctor only in extreme circumstances. They would rather not take time off work and instead prefer to suck it up or shake it off. Furthermore, they are more likely to seek help for physical problems rather than mental ones. Men are also influenced by cultural stereotypes to ignore screening and preventive health care and to delay help seeking for symptoms. As a result, they underutilize health services aimed at early intervention. Subsequently, poor health seeking behavior results in limited use of healthcare services, which limits their access to health information and primary care. Studies consistently show that wives and female partners are significant sources of health and nutrition information for men. They also provide social support, make medical appointments, and accompany them to medical visits. Thus, men's health information should also be targeted to women so that they can assist in keeping their male friends and family members healthy. Men's health issues. The top causes of death in U.S. males in 2017. And you can see here that heart disease is the primary killer and the numbers increase. Top causes of death in U.S. males, and we can see that heart disease is the top killer, followed by cancer. Men's health status vary by age, culture, race, ethnicity, SES, and geographic location. Major health issues: cardiovascular disease, HIV/AIDS, lung cancer, depression and suicide, prostate cancer, erectile dysfunction, diabetes, and aging male syndrome. Heart disease is the leading cause of death worldwide in both men and in women. The major risk factors are hypertension, smoking, obesity, stress, sedentary lifestyle, alcohol abuse, and unhealthy eating habits. Men's arteries develop atherosclerosis earlier than women's, but the reason is unclear. Men tend to suffer from hypertension or high blood pressure more than women because they have lower levels of estrogen than women. The highest rates of hypertension is seen among African American men. And the risk factors are obesity, stress, sedentary lifestyle, and unhealthy eating habits. Prostate cancer is the second leading cause of cancer death. Prostate cancer is the second leading cause of cancer deaths among men in the U.S. The incidence of prostate cancer is highest among African Americans, and it increases with age. 70% of all men will develop prostate cancer if they live long enough, but most of the time, it does not necessarily mean that they will die from prostate cancer. In 2018, men accounted for about 81% of the new HIV diagnoses in the United States and dependent areas. Most new diagnoses among men were attributed to gay, bisexual, and other men who have sex with men. There also is a high prevalence among incarcerated men, and substance abuse also influences risky sexual behaviors. Aging male syndrome, also called menopause or manopause. Aging male syndrome, sometimes referred locally as menopause, occurs due to a drop in testosterone levels. It is usually experienced by men between the ages of 35 and 65. Testosterone is a hormone that helps maintain sex drive, sperm production, body hair, muscle, and bone. Testosterone levels decrease over time. This decline is a part of normal aging. Unlike women, men do not lose their fertility as they age. The use of testosterone therapy is getting increasingly popular, but the safety of it is not known. Some of the symptoms of aging male syndrome are weight gain, especially around the middle, problem sleeping, less interest in sex, fatigue, feeling irritable or angry, erectile problems, inability to concentrate, depression, and mood swings. Nutrition. Most men consume diets that do not meet the dietary guidelines for Americans. They also tend to skip meals, especially breakfast, eat out often, consume low amounts of water, fruits, vegetables, and fiber, and consume high amounts of meat, protein, sports drinks, and alcohol. Recommended health screenings. Annual checkups are important. They also should be immunized. Flu shots every year starting at age 50, tetanus diphtheria shot every 10 years, pneumonia shot once at age 65. And that's once a year at age 65. And hepatitis B if needed. Blood lipid levels should be checked at least every 5 years starting at age 35. Checks should begin at age 20 if the man is a smoker, diabetic, or has a history of heart disease. Colorectal cancer screening should be done starting at age 50. Prostate cancer screening. Men should talk to their doctor about the possible benefits and harms of prostate cancer screening. Diabetes test should be done if high blood pressure or high cholesterol is present. And depression screening should be done if a man is feeling down for the last 2 weeks. An HIV test should be done if sexually active based on recommendations from the doctor. In summary, culture shapes the way that men perceive and respond to illness. Gender is one of the most important sociocultural factors that impact men, and men have significantly less healthy lifestyles than women, are less likely to participate in preventive health screenings, and are less willing to seek support in situations in which help is needed. Thus, more programs and messages need to be specifically tailored to men.